We're tackling a critical topic for your phlebotomy exam: patient identification, specifically the two-identifier rule. The foundation of patient safety, and a concept you will definitely be tested on, is always using at least two unique patient identifiers before any blood draw. The most common and accepted identifiers are the patient's full name and their date of birth. Another primary identifier your exam might mention is the medical record number. Your exam will present scenarios to test this. For example, you enter an inpatient's room with a requisition. You must actively involve the patient by asking an open-ended question like, "Can you please state your full name and date of birth for me?" A classic exam trap is a question where the phlebotomist asks, "Are you Jane Doe?" This is incorrect because a confused or medicated patient might agree even if it's not them. After the patient states their information, you must then compare it to their hospital wristband. The information must match exactly. The exam will test your ability to prioritize safety, so if there is any discrepancy, you must stop and have a nurse resolve the issue before you proceed. A very common exam question involves incorrect identifiers. Never use the patient's room number or a sign on the bed as an identifier. These are temporary and unreliable. The exam will try to trick you with these options because they seem convenient. If a patient is unable to communicate, you must have a nurse or a relative identify the patient, and then you must match that information to the patient's ID band. To help you remember the correct process, use this phrase: ask, don't tell, then match the band. This reminds you to ask the patient to state their information, not tell them the name, and then to match it to their wristband. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.